What we have realized, emergency departments aren't broken because of people, they're broken because of systems.
Was there anything you saw, or like some sort of a moment that you witnessed in healthcare that made you realize that the technology wasn't being used to its full potential for hospital operations?
So that was the moment for me when I realized there needs to be a system that support patients, but also clinicians, because
Is there any particular component of healthcare, of the operational side, that you feel is the most overlooked?
yes, having data in real time. What we have learned is hospitals have a lot of data, a lot of.
How do you define the line between AI making a decision and AI supporting the human's decision-making process?
Our goal is to help clinicians see what matters faster so they can make decisions better under pressure.
Hello and welcome to Healthcare Journeys. I am your host, Kevin Rosenquist. Thanks for joining me today.
This podcast is brought to you by S2M Health, a trusted partner for U.S. healthcare payers and providers. From accurate risk adjustment coding to full spectrum RCM services, S2M Health combines clinical expertise with precision operations to drive better outcomes across the healthcare ecosystem.
When we talk about the healthcare crisis, we often focus on the shortage of doctors or the cost of medicine, but we rarely talk about the invisible logistics that keep a hospital from grinding to a halt. Our guest today is the architect of a new kind of air traffic control for healthcare. Danneelle Crisp is the founder and CEO of ElleLogic AI, a Canadian health tech company that's moving hospital operations from reactive firefighting to predictive precision. With a deep background in systems design and operations, and recently recognized as a 2025 Startup Fest student entrepreneur, Danneelle isn't just looking at the data, she's looking at how patients move through a system that was never designed for this level of complexity. Danneelle, welcome.
Hi, thank you for having me today.
Absolutely, I'm excited to chat with you. You have a very impressive resume that I went down there. Tell me a little bit about the startup of the year, or Startup Fest student entrepreneur. What did that entail?
Oh, I have to tell you, that's a crazy story. So I wasn't going to go in the first place. Like ElleLogic was a new company. We started in 2025. And the morning of Startup Fest, I bought a ticket, given that we were just a few months old at this point. There was one category of a student entrepreneur because I'm currently doing my executive master's. So I'm still a student. So I pitched and we won the one category we pitched for the first
Wow,
time
that's
we did.
awesome.
Yeah, and we won, we got the prize, and then I was like, okay, so what else, you know? And the final pitch, actually, I was in a car accident getting there.
Oh my gosh.
Yeah, and I still showed up and I did my pitch. I was like, guys, I did not prepare for this. I was in an accident, I showed up, and yes, maybe sympathy, but
Maybe it helped. Who knows? Wow, that is wild.
yeah, it's a crazy
Well,
story.
congrats on that. Sorry about that. I'm glad you're okay. Hopefully, car's okay too.
It was a little dent, it wasn't the first accident, it happens.
It happens. It happens. Absolutely. Absolutely. Well, as I alluded to, you have a deep background in operations and strategy. Now you've moved into the AI space. Was there anything you saw, or like some sort of a moment that you witnessed in healthcare that made you realize that, the technology wasn't being used to its full potential for hospital operations?
I have to say, my family is also in healthcare. My uncle is a doctor. My mom is a nurse. So I've had insider vision in what's happening behind closed doors. And I have many friends now who are nurses and clinicians. But the key moment for me was in 2024, one of my close friends, their parent went to the ER with significant chest pains after waiting over 6 hours, well over. They sent her home saying it was just heartburn, right? And then within an hour of arriving back home, she died of a heart attack, actually.
Oh gosh.
So that was a moment where I'm like, how could an elderly person go to the ER, wait for such a long period of time, only to be sent home to die?
That's crazy.
Yes.
That's great. I've had a lot of heartburn in my life. I don't believe a heart attack would feel the same way. At least I wouldn't think so.
I hope not. Yes.
Yeah.
So that was
Wow.
the moment for me when I realized there needs to be a system that support patients but also clinicians, because there's two sides to this coin. Clinicians can only do so much with limited information, limited support, but also patients are the ones really at risk. They're risking their lives each time they go to the ER for care if they're not met with the resources needed.
Hmm. Wow, that's a crazy story. But yeah, you're right. I mean, it's on both sides for sure. And so your company is ElleLogic AI. It emphasizes more of a human-centric solution. So in an industry that is kind of often wary of AI, replacing doctors or, what have you, how do you define the line between AI making a decision and AI supporting a human's decision-making process?
Yes. So at the core of ElleLogic, we are building an intelligence layer that sits with emergency departments. Our goal is to help clinicians see what matters faster so they can make decisions better under pressure. We are not replacing clinicians, we're removing chaos around them. Right?
Hmm.
We want to provide them clarity, and with clarity, they need to trust us. Because what we have realized, emergency departments aren't broken because of people, they're broken because of systems,
Yeah.
right? They have a coordination problem, and clinicians are operating blind in an environment that require precision. Think of us as we don't want to add more tech, we want to make existing workflow smarter, right?
Hmm.
From intake to triage, patient flow to um, discharge. We want to be right there with the clinician, helping them to ensure they get support, but also patients get the care they deserve.
Hmm. And I think, obviously not a hot take exactly, but people are a little nervous about AI, and we all know that. But you put it into a healthcare setting where people are already uncomfortable a lot of times. The average person is already uncomfortable in healthcare settings a lot of times, whether it's the insurance process, the doctors themselves, whatever. You're going to add an extra layer of worry. But people need to realize it's not about the AI in the healthcare space is more about processes and making things better and making things more efficient. Do you feel like people don't necessarily realize just how crazy the healthcare world is? Like, I have a sister who's a nurse too, and like, so I have some understanding of how insane it is. Do you think people just don't really realize how broken certain aspects are?
I think they're realizing it now, given the augmented wait time we have,
Yeah.
people in ARs dying in during wait times.
Right.
I think now it's more visible to the public, but for clinicians, they're feeling it more, whether it's from burnout, people just not going in that sector anymore, people stop working or changing careers. But it's something that the more you dig into it, the more you realize there's more problems and more problems, or companies put in point solutions that only fix one problem but create three others. And then
Hmm.
you realize, okay, a lot of hospitals might have long wait times, but this is not the same problem that's causing the long wait time. So how do you go in multiple hospitals, fix the issue, but actually find the core of that issue to create a sustainable solution?
Hmm. Is there any particular, you know, component of healthcare, of the operational side, that you feel is the most overlooked?
Yes, having data in real time. um,
Ah.
what we have learned is hospitals have a lot of data, a lot of informations, but connectivity is simply just not there. You
Hmm.
can go to one hospital today and they can assist you, go to another hospital tomorrow. That information does not follow you. So having access to data in real time, patient histories, symptoms, prescriptions, can save so many lives and help clinicians so much.
It feels insane to me. It's 2026. We have so much technology even before AI. It kind of seems crazy that it doesn't that data isn't readily available. Why has that been so slow for it? Why has it been so slow for the healthcare industry to adopt technology to help this?
Well, once again, technology in healthcare is always not as easily ready, right? Because you have regulations, you have a lot of doctors that are used to it a certain type of way,
Sure.
protections, and once again, having data is power, right? So giving access to data to someone else is you giving power to someone else, because you having that data, you have a now currency why hospitals want to talk to you, and you have that protection. And you want to ensure you're releasing that data to something that is credible, safe, and reliable, right?
Hmm.
So hospitals are a little harder to adapt. And given that everything is paper based before now, having that converted into technical sheets and documents is not easy. It's not an easy
Yeah.
feat. So having those converted is one thing, but having that connectivity in multiple hospitals is another thing.
Yeah, true. And it's not like a hospital can just be like, all right, we're going to shut down for a week and get our new technology implemented. And so it's not like they can do that. So they got to figure out ways to implement stuff while they're still running at potentially full capacity.
Yes,
Yeah.
yes. And hospital strategies are not getting better, right? More,
Right.
more and more people are going to the ER. There are more and more sickness. There are more and more needs. There are more and more things happening in the world now that we need hospitals. But if you have a system that can support hospitals better, have a system that can that clinicians can rely on, that patients can trust, then it no longer becomes a silo environment, but a connected community that people can go and trust that, okay, I will be seen in the utmost priority of my symptoms and my medical history and get
Hmm.
the care I need when I need it most.
So you're a Canadian company.
Yes.
You guys operate in a single payer system that's going to face unique scaling challenges compared to the US. What do you feel like the rest of the world, what can the rest of the world learn from the Canadian approach to integrating AI into public health systems?
Well, there's a lot of things we could learn. In Canada, we have our system might be lacking resources, but we do not lack community here. Uh,
Hmm.
that's something I have learned and something I really applaud Canada about. With ElleLogic, I think if the world look at it either way as time saved, decision improved, or outcome influence, that would change the way we view healthcare. If, for example, in America, healthcare is viewed as a business, and patients, they go to the ER, they really have to think, do I want to have this medical bill? Can I afford to go to the ER? If we can change that perspective of, okay, I'm going to have, instead of thinking I'm going to have a really long wait time plus this really augmented medical bill, okay, I'm going to go there and get the care I need at the fastest possible way with the resources I actually do need.
Hmm.
That would be a better way to look at it. Not as, okay, how much do I have to pay, but what support can I actually get?
Hmm. Yeah, you're not kidding about there's a whole topic for a whole other day, but yeah, it is definitely a business down here. No doubt about that. One of the things I think that hospitals kind of have to operate as in a reactive mode. They respond to a crisis, as it happens, but it's really hard to be predictive in that environment. How, you know, how can ElleLogic help a hospital CEO move toward that predictive model? And what is that? What have you seen that shift do for maybe the mental health of the frontline staff?
Yes. So I have to say, building a company like ElleLogic to be more proactive than reactive, you have to be very disciplined, right? You have to figure out how to balance being accurate, what factors to consider into being more proactive, and what can you do to make sure you can maintain a level of trust and credibility. How we do that is to take in the hospital by their geographical area. Each hospital are located in, for example, I'm in Quebec, in Montreal. It's very French, right? So if I was to go into a hospital here, I would think about, okay, it's a French environment. So our primary language should be French for the hospital systems. We have other secondary languages, but primarily should be French. Okay, well, we have winter, so we have snow. So in a winter, we're going to have winter storms. We're going to have ice storms, we're going to have snow. So whenever the weather is augmenting a certain type of way, we updates with that. So we can now say, okay, there's Halloween coming up. So it's more likely we're going to have more people based on past patterns on Halloween. There's been augmented people in the ER. So we need more resources. We need more staff in the ER. We need this doctor. We can now predict what's happening in the ER. But also a key of our software that is a pros and cons, I would say, some people like it, some people don't, is that we can also notify you when a doctor has been overstretched, when they've been on schedule for way too long and it's time for them now to take breaks, because breaks is important being a
Yeah.
doctor, high
Yeah.
stress, high pressure. So
Yeah.
we have that little ping on our schedule, like, okay, this doctor have worked 2 double shifts now. Having them work another shift will not be the best decision, right?
Yeah. They need to go home and sleep.
Yes. So we have that feature that not all of our customers would like, but it's a good option out there so you can make sure you're making the right decisions to help mitigate certain risks, certain incidents in the ER to make sure everyone there is optimal and no longer now we are thinking about, okay, how can we react to this? We're like, okay, we're fully now prepared, we're fully staffed, we're fully equipped for what's to come.
Do you find that doctors and nurses in Canada have the same burnout issues that we see here in the States?
100%. A lot of people now in healthcare, we have the shortages. We have people looking for different careers. We have
Yeah.
people saying that it's not a good environment to be in right now. The wait times here are crazy.
Yeah.
It's not the best environment right now. Yes.
Yeah. It feels like obviously COVID had a lot to do with that, of the burnout. I know that a lot of people down here had a lot of burnout, and there was a lot of issues with that coming from COVID. Do you feel like that was a big part of it? Are there other factors at play?
I think COVID really showed us the system we had and why we need to improve and why it would not work going forward. COVID was really a stress test for our health system and emergency systems and really showed the cracks and opened them wider in
Hmm.
COVID, right? And from then on, which is now, is continuing to widen that gap to show us what really matters and remind us that healthcare is about people and it's about people being there for people. It's not about the bottom line all the time. It's about the impact you make in someone's life, and that going to the ER, people are looking for care and human centered technologies, not that they don't want the best results or the best medicine, but they sometimes I'm going to speak about my grandmother a little bit. She sometimes would probably go to the doctor to have someone to talk to, right? Because
Hmm.
you can. Does that mean like you don't need a system like this that can say, okay, she's a repetitive offender, but to have that system where you have that bandwidth now to say hi to an elderly lady, wouldn't that be nice again to bring that back?
Yeah. Yeah. I like that. I like that. Yeah. So you mentioned before that, moving from hospital to hospital, not a lot of communication there, but it can even be in the same hospital, right? Where pharmacy doesn't talk to radiology, doesn't talk to nursing. It feels a lot of times that they're kind of all in their little bubbles or their own little silos. Do you feel like AI can act as that sort of connective tissue to bring these departments together?
100%. It's crazy to think that you can be in the same hospital and go from the ER to the ICU and they ask you the same triage question.
Yeah, they ask you all the same stuff, and you're like, I just did this.
Yes. What's your name? It's a work injury. How long have you
Yeah,
been here?
yeah,
So
yeah.
honestly, that's exactly what we see. It's not between just hospitals, it's within them. You have all these highly specialized departments and people within and systems doing great work. They're operating in silos though. So because the systems don't naturally connect with them, enter the hospitals. And I think that's where AI can play a really important role, not as another system, but as a connective tissue, as you said. And the way I think about it with ElleLogic is, how do I create a layer that sits across those workflows and brings the right information to the right person at the right time? Because the issue isn't that people aren't communicating, it's that systems aren't designed to support real-time coordination. So if you solve that, you don't just improve efficiency, you actually improve how care is delivered.
Yeah, and again, we talked about the burnout and stuff like that. I mean, all these things can help, doctors feel more confident and less stressed, and nurses to feel less stressed, patients to feel like they're getting better care. There's no downside to this ecosystem being, sort of self-sustaining.
100%. And if you look at it that way, being self-sustaining, then you have to think about it as, okay, how do we do that in a way that, as you said, there will be no downside, because that is the goal, right? The opportunity here is huge in terms of reducing burnout, improving confidence, but only if it's done thoughtfully.
Hmm.
Because if you introduce technology that adds complexity or disrupts workflows, it can actually have the opposite effect, right? So
Hmm.
for us, the focus is really reducing the cognitive load, not adding to it. And when it's done right, you can see that shift. Clinicians feel more supported and decisions feel clearer. Patients feel that difference in the quality of care they receive. But it has to be designed around a human, not the technology.
Hmm. Yeah, like you said, it has to make things easier. They don't have time to like learn some robust, complicated system. It has to kind of has to be somewhat plug and play, right?
Exactly.
Yeah.
That's the goal.
Hmm. So, a lot of tech startups out there, they move fast. They have the ability, or at least the flexibility, I should say, to maybe move fast and break things. But it's kind of hard to do that in a hospital setting. Do you find it's difficult to balance that need for rapid innovation with that extreme kind of do no harm caution required in healthcare?
Well, put it this way: what is speed without clarity, right? You have to see where you're going for you to go somewhere most of the time. And honestly, healthcare forces you to rethink the whole move fast and break thing mindset. Because here, if something breaks, it actually matters,
Yeah,
right?
right. Hmm.
And for us, it's not about moving slower, it's about moving deliberately, intentionally. And we spend a lot of time making sure we build things that fit naturally into existing workflows, because the last thing you want to do is to introduce friction in a high pressure environment.
Right.
The way we balance this is by starting very focused, solving a specific problem and high impact problems, and then scaling from there once we know how it works safely and effectively. And so, still, it's innovation, but it's disciplined innovation, I would say.
Disciplined innovation. I
Yes.
like that. I like that. How far are we from? I'm gonna have you put your Nostradamus cap on and tell me, like, AI is moving fast, obviously. How far are we from where just so many aspects of the process are automated or helped dramatically by AI?
Not that far, I would say. I would say,
Yeah.
given how we are right now, keep in mind where we started with AI. I know AI is a new thing for everyone, but AI has been around for decades. It's just now been so publicized and everywhere. It just penetrated with everywhere all at once, right?
Right. Sure did.
So it's the future of AI is the momentum of what we are right now, right? AI is definitely moving fast, but in healthcare, adoption moves a bit at a different pace than in technology itself. So I would say we're already seeing meaningful impact today in specific areas. Things like triage support, patient flows, documentations, where AI can reduce a lot of the operational burden. But in terms of fully automated systems, we're still a few years out, I would say. And honestly, I don't think that's the goal. I think the shift is augmentation, right? That's where the real goal is, where AI is handling the complexity in the background so clinicians are able to focus on the actual care of the patients. So it's less about replacing the process and more about making every step of it faster, clearer, and more coordinated.
That makes a lot of sense. Makes a lot of sense. When I talk to my parents about AI, because they're just confused and terrified by it, I always try to say it's a tool. Don't think of it as a replacement. Don't think of it as like, robots taking over. Think about it as a tool to make your life more efficient in a lot of ways.
100%.
Yeah. Yeah, I agree with that for sure. So tell me, so LAI, so how does that get integrated into a hospital? Obviously there's a lot of steps here. Give me the Cliff's Notes version of how someone would get started.
Right. So first, I hope they're interested. you know, um, but how someone gets started with ElleLogic is either we reach out to them or they reach out to us. They can reach out on our website or just just spam us. That's okay too. But in reality, we approach it in a very phased and lightweight way because once again, we do not want to create additional load.
Right.
So first, we integrate with the hospital's existing systems, like their EMRs, EHS systems. So we're not replacing anything. We are laying on top of already what's there. Then we typically start with a very focused use case. So, like intake or patient flow, what is your core problem? So, teams can see value quickly without having to overhaul everything, right? And
Hmm.
then from there, it's really about gradual adoption. So, clinicians get started using in their day to day workflows. We gather feedback and then we refine and then we expand. The core of our system is that we help clinicians. So we have a lot of feedback sessions. We have a lot of sessions where they give us their input or something they would like to see in a feature, or it'd be great if we had this. We take all those comments back to our drawing board and see how best we can implement them on a bigger scale. So it end up feeling less like a big tech rollout and more like a natural extension of how they already work.
That's really cool. And I think that goes back to what we were talking about. Like that's a good way to put it, the big tech rollout. It's like you can't just shut the hospital down to do this. You have to implement it in real time while you're still working. So that's really cool. That's very cool. I'd like to end with this is because you're a founder and CEO. I'm sure you look at leadership a lot, or you think about leadership. What is the most significant lesson that you've learned from your journey so far about leading a team through the high pressure environment of health tech?
Wow, that is a great question to end with. Was not expecting that turn. Um, I have to say I'm a second founder, but this is my first tech company in a health tech um, environment. I think the biggest lesson has to be that clarity matters more than speed. In a high pressure environment like health tech, there's always urgency. Things are moving fast, expectations are sky high.
Hmm.
But if your team isn't clear on what you're building and why, that pressure just turns into noise, right? So I
Yeah,
really learned to focus on keeping everyone aligned around the mission and what we're making to ensure that we're solving the right problems and not just moving quickly. Because then when the team has clarity, they can operate with confidence, even in uncertainty.
that's great. And two companies, two foundings already. You've done a lot with your life in a short amount of time.
I
That's
mean,
very,
life was meant for living, right? So
yes. Hey, I agree. Good for you. I love it. That's great. All right. Well, Danneelle Crisp, thank you so much for joining me. The company is ElleLogic AI. Check it out for sure. Danneelle, really appreciate your time. Thanks so much.
thank you for having me.